Coalition. LTCCC is a nonprofit, nonpartisan organization entirely dedicated to improving care and quality of life for people who live in nursing homes and assisted living. Our focus since our formation in 1989 has been on policy research and analysis and systems advocacy stemming from that policy research and analysis. And I would say over the past dozen years or so, we've focused a lot of our work on public education, translating some of the policy research, some of the data to educating residents, families, long-term care ombudsmen, and those who work with residents and families to help them understand and be empowered about to advocate for the issues facing their residents and their facilities. And lastly, we are the proud home of 2 local long-term care ombudsman programs here in the Hudson Valley in New York. Our website is nursingHome411.org. And I'm going to, when that gets started with our webinar, Impacting Inclusion for LGBTQ plus Elders, the Long-Term Care Equality Index. I'm really excited about today's program. It's in commemoration of Pride Month, which is June. I'm very happy to be doing it and really excited about our speaker today. Our speaker is Dan Stewart, and he is the Deputy Director of the Aging Equality Project for the Human Rights Campaign Foundation. Dan provides leadership and management for the LGBTQ Index and other projects to promote LGBTQ plus inclusive policies and practices in long-term care and senior services. He received his BA from St. Louis University and a master's degree in gerontology from the University of Missouri, St. Louis. He's a Chicano, a transgender man, and a gerontologist. And I am really excited. A little bit more about him is here. But without further ado, I'm going to pass it on to Dan. And, oops, sorry, that's my slide at the end. Thank you, Dan, and welcome.
Thank you, Richard. And thank you all for having me here today. I can go ahead and share my screen.
Yes, let me stop sharing. Sorry.
Well, hello, everyone. My name is Dan Stewart. I use he, him pronouns, and I'm the Deputy Director of the Aging Equality Project at the Human Rights Campaign Foundation. I'm very happy to be here with you all here today to talk about LGBTQ plus elders, what inclusion looks like for this population, their care partners, as well as employees, and ultimately leave you with some tips to take back to your community, to your search for inclusive care, to those that you may be serving out wherever you are located. Again, my name is Dan. I'm with the Human Rights Campaign Foundation. You got a little snippet of my my bio, but I just wanted to share a little bit about how I got into this work. In 2012, I began my career working in long-term care as an activity assistant, activity coordinator, activity director over the years, and had the opportunity within the state of Missouri to really see firsthand skilled nursing and long-term care. I expanded my career to go into the ombudsman program, did a brief stint as a PhD student doing research for folks with cognitive decline as well as the LGBTQ community. But things really came together when I was working on my master's in gerontology. And on my second day of class, my social gerontology course instructor told us to take 20 minutes and write what your life will be like at 80. At that point in time, I had just come out as transgender. I just beginning asking others to use a different name, different pronouns, hormones. And I realized quickly that at 80, I would probably have to rely on supportive help of formal supports and services. I wasn't married or partnered at that time. My family at the time weren't quite close geographically. And I realized that I would have to rely on others to help me continue as my true self as I age. And so I decided to look and see what was out there in the literature. And Karen Fredrickson Goldson out of the University of Washington, Seattle, she has a national longitudinal study that's been going on for nearly 10 years focused on this population. And what the research shows and what we'll go over in a few slides is a population that is in need, that's invisible, and that historically has feared services and support, and in their time of great need are not accessing it, are hiding themselves in the closet, not receiving the services and support as they need. And so in my work as an academic and now as an advocate and working in the intersection of aging and LGBTQ equality. Really happy again to be able to be here with you all and share space and speak about how we can best support the aging population. For those who may not be familiar with my organization, I'm going to go ahead and turn on our captions for everyone. For those that may not be familiar, the Human Rights Campaign Foundation is the nation's largest LGBTQ plus advocacy organization in the country. With about 3 million members and supporters, we work across the US in various capacities, working with systems to improve inclusion for lesbian, gay, bisexual, and transgender people. For 40 years or so, our 10 programs span the wide variety and gamuts of life. I have the privilege of overseeing our Aging Equality Project, where we focus on making change for elders as they age in place or in communities. So just a brief overview of what we'll be covering today. And again, please feel free to put questions in the chat or the Q&A as we go through. We'll have some time at the end to discuss. But we'll focus a little bit about this population, give you a background about some of the challenges that they're facing, give some insight on what the best practices are, especially in terms of policy. And lastly, leave you with some resources that you can share, utilize in your own search for inclusive care, or if you're a member of an organization that wants to become an inclusive environment. Last month, the Administrative Community Living Administrative on Aging released their 2023 profile on aging in America. And what we see and what we know is confirmation that the aging population is growing exponentially, that people are living longer, but not necessarily healthier. And that the diversity that we see as a nation as a whole, we are seeing in our aging population. That includes racial identity, ethnicity, as well as sexual orientation and gender identity. For decades, LGBTQ plus older adults have often been invisible. But with research that we've done on national level and some federal data, we're able to get a sense of who this population actually is. Though considered an underestimate, currently there's thought to be about 3 million people over the age of 50 who identify as LGBTQ plus. This number, as we know, as the population grows rapidly, is going to continue to grow and double by 2030. And folks are often living at the intersection of identifying as a sexual gender minority as well as a racial minority, with 20% of folks currently identifying as a person of color and a member of the LGBTQ plus community. But I wouldn't be a good gerontologist if I did a blanket statement about all the older adults or all folks who are over the age of 50 and identify as LGBTQ. And I want to state the reason why we say 50 when we talk about this population are a couple of reasons. One is because we haven't had much national data collection that includes questions about sexual orientation and gender identity. And also because of a history of stigma, discrimination, and poor health outcomes, we do see an accelerated aging amongst LGBTQ older people. So over the last several decades, we've seen progress in recognizing, supporting, and uplifting policy for LGBTQ plus older adults and LGBTQ people as a whole. But many of our older adults have lived in a lifetime of legal discrimination, dealing with laws that targeted trans women, the medical system pathologizing homosexuality as a mental illness, lack of visibility, the AIDS epidemic. So when we talk about this population, there's really about 3 different cohorts that exist. And this is important, especially in terms of you providing care and knowing who you're working with. Those that are at the oldest of the spectrum that identify as LGBTQ are those that are known as the invisible generation. They were born in a time where there was no public discourse about sexuality or gender identity. Those that were of the silent generation did come of age in time where there was conversation about sexual orientation and gender identity, but it was quickly paired with risk of loss of job, societal ostracization, loss of family. It was the idea that to be loud and proud was a risk, and therefore being silent was the best means of safety and getting by. For example, an older adult who identifies as gay and was in their 80s currently, so they were born in 1940, as an adolescent, they saw the federal government discharge about 4,500 military members for accusations of being gay. In their teens, the Diagnostic Statistical Manual listed homosexuality as a mental illness, where it stayed for about 20 more years. They also saw the civil unrest in their 20s and so on. So while we've seen a lot of progress with marriage equality and more recognition, it's important to recognize for many of our elders, especially those in their later years, have experienced a much different reality. And lastly, we have our Pride generation made up of folks that would fall under the baby boomer cohort. These are individuals that have been out and proud with their identity for decades, many of them since they were in their teens or 20s, and therefore have an expectation as they enter services and supports and as they live later on into their life, that they'll have the opportunity to be out and proud if they wish. So as we think about these populations, know that it's one that's continuing to grow, one that we're getting more information about, but again, continuously diverse as well. What the literature shows, though, is that this is a population, regardless of other identities, identifying as LGBTQ+, having a less likelihood to be partnered and less likely to have children. When we think about the aging support systems and the aging systems within our country, often informal caregivers, those that are family members or friends, make up often a key component of someone's care plan as they age. For LGBTQ plus individuals, there's a less likelihood to have these care partners in place, and in turn must rely on supportive services and care as they age. Unfortunately, because of the distrust of medical institutions and systems as a whole, many of our elders avoided preventative care. Therefore, towards the end of the later years in their life, are facing a higher likelihood of developing chronic health conditions, disease, as well as disability. So partnered with the less likely to receive care, we're often finding folks finding themselves in a place of immediate need and then not knowing where to turn to. Ideally, many individuals want to continue to age in place at home, but the reality is for many of our elders, they don't have those support systems in place and do need to rely on those formal services. I do want to share a brief story of a dear friend of mine. As two couples, both women were in their late 80s. And one woman several years ago received a poor prognosis of stomach cancer. At the time, I was working for a St. Louis-based LGBTQ aging org, and I received a phone call from this woman. And she let me know about her cancer diagnosis, but her main concern was not her own health, her own safety, concern about herself. What she said to me was, if I go down, we all go down. She was the primary caregiver for her wife. She was the primary driver for their small friend group. Many of our elders are existing within very tenuous peer-to-peer caregiving, and often then are in necessary need of welcoming services that they know they can turn to. AARP Foundation has been doing a plethora of research specifically as it pertains to LGBTQ plus populations, asking as young as 45 plus in terms of people's views and opinions of what they worry about as they age. And LGBTQ people have many of the same concerns about long-term care that non-LGBTQ people do. You know, how much will it cost? Will I receive quality care? What does it look like? How will I afford it? But there is the additional concern because of their identity and history that LGBTQ folks have when it comes to accessing these services. Over 60% of folks who identify as a member of this community are worried that they may experience verbal or physical harassment or even lesser care when seeking services and support. But the positive thing is that folks, when expressed their interest in a community that has undergone training, their hope as well as comfort levels increase. About 88% of folks have stated that they would welcome and want to go to providers that have undergone some sort of sensitivity training. For many of our elders, LGBTQ people often fear they may have to move from where they live to find proper care. When in actuality, what we find is that many organizations are wanting to develop a place of belonging, a welcoming space, but may not know what steps to take. And so our organization, in partnership with SAGE, had developed a tool specifically within senior living with principles that can be applied to the greater senior services called the Long-Term Care Quality Index. And what is made up of that in a welcoming space are those policies and procedures training, as well as environment and culture. So I just want to share a short first video of what the LEI is.
If you don't think you have lesbian,
gay,
bisexual, and transgender people in your long-term care community,
think again.
Upward of 5% of your residents are members of the LGBTQ community.
We are living in your communities and may stay silent or in the closet.
Because we are afraid of discrimination.
That's not surprising, since many of us have lived for decades under legal discrimination.
Discrimination that persists today.
There are over 2.5 million LGBTQ people over the age of 50 living in America today.
Experts predict that by the year 2030,
close to 7 million LGBTQ elders will be seeking care and services.
That's why it's more important than ever that long-term care communities like yours support us as we age.
and treat us with dignity and respect so that we won't be forced to go back into the closet.
And it is often more difficult for Black and Latinx members of our community.
Fear of inadequate care and discrimination are compounded by racism.
Across the country, LGBTQ elders are not getting the care and support we need to thrive.
Let's change that.
The Human Rights Campaign Foundation and SAGE believe
That most long-term care communities want LGBTQ elders to feel welcome and get the care they need.
And deserve.
And that's why the LEI exists.
the LEI helps long-term care communities adopt better policies so that they can provide culturally competent and responsive care to LGBTQ elders.
with your help, we can change the future.
Let's make sure that long-term care communities are welcoming and inclusive to LGBTQ elders like me.
And me.
And me.
And me.
And me.
Sign up for the Long-Term Care Equality Index today.
I see some questions coming in, and we'll make sure to catch those at the end. So the Long-Term Care Quality Index is a national benchmarking tool that was and survey designed to both assess a long-term care and senior housing communities' current policies and assist them in reviewing and adopting inclusive policies for their residents, visitors, and staff. This is mirrored after our work for the last 17 years with about 1,000 hospitals across the country with our Healthcare Quality Index, as well as our hundreds and hundreds of corporations that participate in our Corporate Equality Index. Our survey opens up in July. That's open to senior housing providers to take to show in their commitment to LGBTQ plus inclusion, as well as get a sense of where they are in terms of best practices. Those that participate are placed on a searchable database for consumers to search, as well as have an opportunity to receive a tier of recognition. Just as a heads up, and they'll have some links in the chat as well as the landing page for the webinar. In total, there are 40 best practices that we ask about over the course of 4 core objectives. Our first core objective is to ensure that residents, visitors, and staff feel safe and are protected in terms of their non-discrimination protections, as well as staff training. 2, we encourage organizations through this to demonstrate progress towards inclusion of LGBTQ residents, services, and staff. 3, to foster an inclusive workplace for the staff and in terms of employees and benefits. And 4th, lastly, demonstrating engagement with public commitment to the LGBTQ plus community. These 40 best practices are presented as more of a menu of options, with many of them informed by our advisory council made up of experts in the field of long-term care, aging, LGBTQ plus rights. For organizations that are located in states such as California, New York, New Jersey, DC, Montgomery County, Maryland, we're now starting to see the passage and inclusion of LGBTQ Bill of Rights. These resident Bill of Rights are necessitating inclusive policies and practices for LGBTQ individuals. Many of those practices are replicated within the survey criteria, meaning that if you are located in states such as New York or California, providing leveled unskilled or assisted living by following the guidelines of state law, you all will be well primed to receive a tier of recognition. The survey itself is open to the gamut. Long-term care is the name of the project, but it is a bit of a misnomer as we do expand to more independent levels of housing. So the full list includes life plan communities, continuing care retirement communities, skilled nursing, assisted living, independent living, active adult, affordable senior housing communities, and freestanding hospice communities. We have opportunities for organizations that have multiple properties to take a handful of surveys versus one for each individual actual property. We're very proud to have some large system sign-ons such as Watermark, United Church Home, and Human Good. We just had our first survey back in 2022, and in 2023, we had 200 participants. We're primed to around 400, 500 this time around, 23 within the New York area. And these are organizations that, again, have completed the survey. We really see the importance of lifting all folks that are taking the efforts to review, to make this commitment to older adults who identify as LGBTQ+, as well as their loved ones and staff members. But I want to show an example of what does this look like in practice by sharing the story of Jan and Norma.
We met in 1986. We've been together ever since. We really enjoyed each other, and that we complimented each other. Our personalities are quite different, and yet it's complementary.
Well, when I first saw, Norma had a friend that was living here at Edenwald, and I saw this high rise, and she came back and she said, "This is a pretty nice place." I said, "I am not going to spend my retirement in a high rise."
Tell them what floor we're on.
17. And the only downside is the birds don't come up that high. It's the best place for us it could be. I mean, we didn't know what to expect, but the openness and the friendliness. I mean, I know everybody that's been here says it's so friendly, and that really is true.
To me, that is the sale. We have gays and lesbians that live on campus. We have staff who are transitioning. I want everybody to feel that they can come here and just be themselves.
We did a pretty thorough research.
We wanted a database that we could search, and there's no such thing. So I'm glad that HRC is doing something that can help other people who are floundering find us.
The long-term equality index speaks to our values as an organization. So that is one of the reasons that I let a staff of residents and community members make the decision that this is something they wanted to pursue because they felt that it spoke to our values.
We asked Diane, as we were being interviewed, will we become a problem? The fact that we're a couple, will that be a problem? And she said, absolutely not. And if ever you feel that it has become an issue, let us know.
We are a community of 60 to 100-year-olds, so there's all sorts of people that make up the Edenwald community. But what was interesting is as we started talking about this, we realized it wasn't as radical to the resident population as some people might think. You know, I think once you get to a certain age, you really start to realize that there are certain things that are important and certain things that aren't. And the residents that have chosen to live at Edenwald know that this is not really an issue for them.
You know, it's that type of place that Steve knows everybody at the front, my son Steve. Everybody at the front desk come in, hey Steve, how are you? And how are your moms? And so it's just like being at our home.
I want everybody to feel that they can come here and just be themselves. And not only from just a social justice perspective, but also it's business smart. Senior living struggles to staff communities. We, through the pandemic, through the Great Resignation, have been fully staffed here. We have no issue recruiting for any position that we have open because people want to come here because of the culture that it has. You know, most senior living communities are not places that I would go to. I really want to create somewhere that I would absolutely enthusiastically move into.
We feel validated when we're in an environment where people know, and it's talked about, not danced around, but talked about. It's very validating to be in a community where you know you are a part of it, an integral part of it, not a side feature.
It's almost a non-issue. The acceptance, you forget about it, that it is an issue, because here it doesn't seem to be.
I had the pleasure of spending a couple days with Jan and Norma out in Maryland, and they shared their story of their relationship. They had been together for 40 years and made a decision in the 90s that they didn't want to have to hide their family anymore. And when they were seeking care as a married couple, really were unsure where to go. As they said, they really tried to keep a list of potential places that they could move into. But I will say there was a community in their area that was specifically LGBTQ centered and focused. However, the layout of the community was a sprawling campus where much of the activities were separated where folks were living. And for two women that were thinking about their aging process and the need for mobility devices, that wasn't an option. And so finding a community that was inclusive right in their area that they had spent decades in, as well as able to meet their needs in terms of care and their future goals, it made a great match in finding inclusion in their community. I want to go over a few resources before we switch over to questions, some links in the chat. So there are two key websites here, the lei.org, where you'll find more information about our project, the Long-Term Care Quality Index. There we have a plethora of online resources and support that includes what these best practices are that I spoke a little bit about, as well as templates for policy development, information of examples from the field. If you are not in the long-term care senior living space, but interested in making changes to be more inclusive, feel free to reach out to us. We can help you make those connections, as well as reviewing the National Resource Center on LGBTQ plus aging, which can be found at lgbtagingcenter.org. For folks that are working directly with the community and are needing some additional support on how to find an inclusive environment, we've developed a consumer guide that's based on some of the pertinent policies and practices that we see as best practice to look for when looking for services and support. We currently have this in both English and Spanish and available for download. And for folks that may need additional insight into how to find some of these inclusive places, I just have a few tips that I want to share. Again, thankfully, we're in a space where we're seeing more push for blanket coverage of sexual orientation and gender identity. However, that being said, there is an importance of folks not only having that policy in place, but communicating that policy. So keeping an eye out when searching out potential new service providers that you may want to engage with, or if you're looking for a new community. Marketing opportunities in terms of images that involved LGBTQ plus folks, or images that may be associated, such as a rainbow, a welcoming space sticker, looking for those key visual signs. But again, must be highlighted. We highly recommend to ensure that that's highlighted with policy behind it as well. The LEI is a great resource to search for communities in your local area. I also recommend sageusa.care. Sage Care is a credentialing program developed by Sage, which is the organization focused in on LGBTQ aging, been around for nearly 40 years. They provide a list of providers that have undergone training, both at home community-based services, as well as formalized care. And lastly, I highly recommend reaching out to your local networks. LGBTQcenters.org with links to Centerlink, an organization where you can search by zip code the local LGBTQ orgs that might be in your area. For many, many years, and like many populations that may face challenges, often word of mouth, as well as developing trusted allies in the community of knowing where to go, But hopefully we can make this less of an informal role and be able to encourage folks to sign on to things such as the long-term care community, so we can have a national database of those options. And for resources, again, for those that are working directly with this population, social isolation is something that many elders face, particularly LGBTQ plus elders. The research shows it's even higher rates. Sage Connect is an opportunity for a friendly phone call over the span of several weeks, with a commitment of a dedicated volunteer to call and make social connection with the elder. In addition, there is a 24/7 hotline, whether an individual is in crisis, they are lonely, or they need support in finding inclusive services. This is a great line to call in partnership between Sage and 211. The phone number there is 877-360-5428, or LGBT. I want to end with this quote, and then I'll take on some of the questions. But through this work, ultimately, I want to be able to ensure that my elders have access to care where they can be their true selves. Here's a quote from Robin, who lives in Missouri. And she says, "It was important to me to find a community that not only welcomed me, but was also close to my family, friends, and parish. I have lived here a year, and management knows my trans heritage and accepts me. To my neighbors in management, I'm simply known as Robin, who likes to bake cookies and go to church on Sundays. Access to both independent and assisted living communities is paramount for aging LGBT people. I'm thankful for the supportive community I now call home." For Robin and many of our LGBTQ elders, simply they're looking for a place that they can safely call home. And unfortunately, because of their experience, there's been many historical experiences of feeling excluded, that it does necessitate us as providers to take those steps to ensure that folks are seen, supported, and protected. I have my information here on this last page with some key websites. You can scan the QR code to get access to an LEI toolkit that'll give you access to the criteria, commitment to caring pledge, as well as some additional resources there. But I'll go ahead and take some of the questions that we have here. The first is in reference to an office is trying to organize some civil rights outreaches to help educate rural elders about Health and Human Services' new anti-discrimination rules. Do you have any insight to share on how we should frame our outreach materials to signal to the LGBTQ plus community that my office is a safe, welcoming place for them? What additional resources should we try to bring along with us? Well, thank you for the question. What this is in reference to is, I believe last month or a few weeks ago, there was a final ruling on Section 1557 that states that organizations that are receiving federal funding must uphold non-discrimination protection amongst many enumerated categories, but that also includes sexual orientation and gender identity. So I think a key component here is ensuring that the information includes clear designation of what is protected and who is protected in terms of access to hospitals, to long-term care communities that receive funding, and some of the other subsidiaries that receive funding from these sources. Trusted community partners are also a great resource in being able to outreach and reach the actual community that needs to see these services. I recommend the center link, or that lgbtqcenters.org website, to do a search with your zip code to see what local LGBT orgs might be in the area that you could potentially reach out with and partner with. Also, feel free to reach out to me. I'm happy to throw my email in the chat as well to discuss more. I think there's just a lot of work that we can be done for all of us, to get a better sense of what are our rights as patients and residents and clients, and happy to support with that. And then we have I'm going to go to Latanya for a quick question, and then we'll come back to Stephen, which is a little bit more complex. So Latanya asked, what are the primary challenges LGBTQ elders face in long-term care facilities? So from the research of what we show, a key component is about 30% are going back into the closet, hiding their identity. So in terms of being able to bring their full selves, social isolation, even within a community environment, is unfortunately an outcome. We are also seeing individuals who may be out with their identity, but because of lack of policy or procedure for the staff of how to properly engage, are experiencing some challenges within the system. And often, unfortunately, we're just seeing people continuously put off care and say no to support that they could have earlier on in their life. And so that also offers a little bit of a challenge. I will say one thing that we are seeing in addition to LGBTQ elders and their challenges as it pertains to LGBTQ inclusion is that also it's important to recognize that many of our non-LGBTQ straight residents have LGBTQ children or grandchildren and care partners that they also want to make sure that they feel comfortable coming to visit them in their community as well. And then Stephen, we have a question here. It's an example. So I'll go ahead and read the question. So there is a resident that recently transitioned from male to female at your community. She has a preferred name and her legal birth name. So the preferred name is the name that you'd like to go by. Legal birth name is, whatever is on the birth certificate or driver's license. She could no longer direct, so the facility called me for dignity concerns. So I think there might be a concern about capacity here. Family and some friends still called her by her legal name. Her records had her legal name. My suggestion was to treat her preferred name as a nickname. Her preferred name would be on her door. Staff should call her by her preferred name, but her records have both John, Jane, and quotes Doe. This way there would be no confusion for new agency staff. Was this the best way to deal with this? Well, thank you, Stephen, for sharing that. I think that you bring up a very real challenge that folks are facing as they ensure that they're a welcoming space and community. And as we see laws improve in terms of who we can say yes or no to, in terms of identity, where you will find the case with many folks that may be coming in with a legal name that's different than their birth name or their preferred name. I think the approach that you did in terms of treating it as a nickname as you would in the system makes complete sense. For example, my legal name is Daniel, but I go by Dan. You may know the Peggies of the world who are secret Margarets. And for person-centered care, we're going to ensure that we're calling people by the name that they want to go by. For purposes of on the outside of the door, perhaps, for confidentiality's sake, let's say, we do recommend that gender transition status, trans history, sexual orientation, gender identity be considered confidential information, just as you would any sort of HIPAA related information. So there is an opportunity if using all of these people's names on the front door could in turn out them as transgender, although this does seem like someone who may have transitioned while living at the community already, so folks may be aware of their history. I think it's also important of, even if there's a question about capacity of at least attempting to have that conversation and ask about preferences and how the name is shown. I think the key point of what you're bringing up here and doing by including Jane in the title is still making a point that yes, you do recognize the legality and how the paper needs to be written, but at the same time, dignity and respect and person-centered care would say to use that preferred name, nickname. And again, another option for in the future when folks are doing intake to ask about preferred name or nickname, just for all folks. Again, the Peggies of the world.
Dan, this is Richard. I had a question, and I can't put it into the Q&A as a co-presenter. What I was looking at the map that you shared earlier, and I noticed that there are many states and even a large swath of the country that have no communities. And I was wondering if you have any thoughts or people, and like we're based in New York, and of course, New York has New York City and Buffalo and Albany and other cities, but there's a lot of rural areas too where people may feel less comfortable. So I was just wondering if you had any thoughts for people who find themselves in a situation where there may not be good options, and it may be very hard to feel comfortable even divulging in to a provider, no matter to to an administrator or admissions officer, no matter to your care staff.
Yeah, thank you for the question, Richard. And I'm happy to say that in our next round of surveys, we'll have a lot more of that map filled out. We're really proud of some of our partnerships. For example, the Veterans Administration, their community living centers, many of which are participating in the LEI and will be included in this upcoming survey. We are also having a strong emphasis on affordable senior housing, ensuring with our elder population being less likely to have the funds for later life retirement plans in many of those states that we're currently seeing. But I think for folks that are in these areas where currently there isn't a clear sign of where to go, I recommend the consumer guide that I recommended in a few slides. You all have the links to look at those, of really using a critical eye when reviewing websites, as well as even doing tours. I think word of mouth and community can be trusted sources, especially if it pertains to while publicly an organization may not be on a national list, but there are many that have had a history of taking in LGBTQ people for decades because we've been around for decades. So we recommend folks use a critical eye of looking for those images of inclusion, whether that be a diversity statement, the inclusion of sexual orientation or gender identity in the non-discrimination policy, as well as imagery to show a recognition of diversity.
Thank you. I think there are a couple more questions in the Q&A.
Yeah, the first question I see here, what are some common mistakes or oversights facilities make when they're trying to create an LGBTQ inclusive environment? Thank you for this question. I think the intentionality is very important. I'll give you a brief example. There was one provider that was located in Texas, and they had communities in Houston, Dallas, and then out in West Texas, a little bit further out. And they decided as a kickoff to their inclusion efforts, they were going to do a drag bingo. It went well in Houston, it went well in Dallas, and in the West Texas campus, it blew up. Staff were upset, residents got upset, it got shut down, and ultimately had the opposite intention of what they were trying to do. And I think this is just a short example of what we see at times where folks, the staff especially, may feel ready to go ahead and raise the rainbow flag. But there's a lot of steps that need to happen beforehand in terms of talking about what your mission is as an organization, really trying to see these inclusion efforts as a part of your strategic plan, informing your staff that you'll be taking on to this charge. We're currently in development of making a toolkit for folks to use to explain to their residents, what does this mean? I think there's hesitancy and so folks choose not to engage, or if they do, let's go ahead and jump right in. But what we find is, developing even a committee of residents, staff, family members that are dedicated to highlighting diversity issues as a whole, or if you want to focus in on specifically LGBTQ+, can be used as a way to really show that this is an effort coming from the community versus someone up top in administration. And the way that you can do that is really talking about the context of the impact of reaching communities that have not had access, as well as recognizing our diversifying workforce as well. I'll hop into a third question that just came in that I think is related. It asked about the role of resident and family councils play in supporting LGBTQ+ inclusion. And often we find them as a really critical piece in organizations that have taken a system level approach to creating an inclusive environment, ensuring that they're getting feedback from their residents, from their staff. In one community, we actually saw a situation where there was a older transgender woman who had moved into the community, and she had offered to do a presentation on what it meant to be, a transgender woman, her experience. And she actually ended up falling sick that day. But some of her family members, as well as some of the residents that knew her on the resident council, decided to hold the session anyway and led an entire conversation about what does it mean to be welcoming and affirming. And because I guess what we're seeing often, there is a thirst and a desire for this knowledge, or conversations. And I'll put in the chat a great resource that actually can be a talking point. Sometimes there might be a hesitancy to talk about sexual orientation and gender identity amongst residents, or thinking in that terms. But what we're seeing again is many family members coming out as LGBT. And so in turn, organizations are trying to seek resources for their residents. Here's a great resource called Supporting Your LGBTQ plus Grandchild. We've actually used this and support the usage of this in different long-term care communities to just have a conversation about it within the context of being supportive to your family members. I'll go ahead and answer. There's a question related to my vision for the future of LGBTQ inclusion and how we can achieve it. I think for inclusion, there are multiple approaches. On one hand, and the work that I do is really working with the systems that we have at hand. The aging systems, the long-term care field, really working within the policies and procedures that we already have in place, and we can just tweak them a little bit in order to make them even that much more expansive and supportive. I remember 14 years ago when starting this work, and we were cold calling folks and organizations saying, we don't have any LGBTQ people here. You know, this topic isn't something that's relevant. To fast forward now, and we have a federally funded research or federally funded resource center on LGBTQ aging, and there's national projects about this topic. And I think we're seeing more embracing from providers themselves. And then on the other hand, we're also seeing the development of LGBTQ-centered housing. So it's very specific to LGBTQ folks. Of course, it's open to everyone with equal access to housing, but they are tailored to this population that we're seeing pop up in various states from Ohio, Arizona, New Jersey, Virginia, all over. So I really see, as we continue to really embrace and recognize the diversity within our resident population, within our staff, with really those equity mindset being at the center, I think folks can see the puzzle pieces that can come into place. And then we have another question about when looking for an inclusive community, what are some of the important things to ask or to look for? And I think first and foremost is on the website in terms of if there's a non-discrimination policy, if there's a diversity statement. We are seeing more long-term care and senior housing communities start to put out messaging about their commitment to equity and inclusion, both within the residents as well as the staff. Looking in terms of being honest and asking as well if there are any other LGBTQ residents that they know of that live there. Have they ever asked? Some of our communities are still learning what this all means and wanting to be inclusive, but may not have the right steps in place. So I think part of the process of looking for and encouraging consumers to ask questions, we're also hoping that this will continue to push these providers to understand that folks will be trying to take into account how inclusive a community is when they're looking for themselves or their loved ones. And lastly, the LGBTQ is just one component of what could be an inclusive environment. I also recommend checking out the star rating systems, local insight or reviews of communities as you try to kind of piece the parts together of what you're looking for when it comes to inclusion.
Dan, thanks so much. That was just fascinating. I have just one more quick question. I don't know if it's quick, but anyway. A lot of what you talked about, I mean, I've seen some things from the Administration for Community Living that have been really positive in this regard, and that I think really support some of the things that you've been talking about today. I'm just wondering if you, maybe as kind of the last question, if you have any thoughts, both in terms of things that are promising and things that are challenging politically with what is going on.
Well, I'm very encouraged by the LGBTQ resident Bill of Rights, the senior Bill of Rights that we're seeing find success. I think New York just had theirs in 2020, which was just passed. And, these are ultimately laws that are ensuring protections for LGBTQ folks when seeking long-term care or senior services. But not only that, but it gives you access to training as providers, as well as the best practices of policy. So I think that's a positive direction that we're going in. I will say with a lot of national rhetoric that can be really challenging, that often is targeting youth, our elders are still affected by that. And so we are seeing a lot of individuals, really their anxiety increase of, will I have anywhere to go? Will I be safe? And so really encouraging providers, to take the steps that they can, whether it's, ensuring that a policy is showing up on their front page of their website, or that there's, a small rainbow acknowledgement somewhere on a website to ensure that you're aware of this population. Because again, invisibility is also a key piece of what folks are fighting against when it comes to seeking services. But what I really find empowering in all of this is that while we have the stats that show the negative impact of how things have been, we also know and see how transformative it can be. And on the other hand, I love being able to share the story of Jan and Norma, who for them, they can just go and live in their home, and their son comes in, how are your moms? And everything is just normalized as going about their business, and they can go to their exercise classes and go to dinner and say hi in the hallways. And that's the level of ease that we want to have for everyone. But I know that necessitates some work on our end as providers, and for me to help support you all and ensuring that those policies are solid and written down, and have been affirmed by and worked and shown success in hospital settings, as well as validated by lawyers and things of that sort. And it's completely free to participate.
Thank you. Thanks so much, Dan, for just a fascinating and valuable program. We really appreciate it. A few closing slides and announcements. Our next Family Empowerment Program will be next Thursday, June 27th at noon Eastern. And we're going to talk about what to do when nursing home staff is not responsive to your concerns. So you're welcome to come with questions and comments, et cetera. We'll try to get to as many, have an interesting discussion there. And then our next webinar for July our guest speaker, will be Eric Carlson from Justice and Aging. Many of you know Eric, both for his strong advocacy, but also because he is the author of, if I remember correctly, 25 nursing home problems and how to solve them. And the title of this program is What's Wrong with Long-Term Care Facilities and What You and I and Residents Can Do About It. You can register, you can see the link below, or on our website. Just look at the webinars drop down. And then lastly, head to Nursing Home 411 for materials from today's webinar. And we'll try to get up as many of the links as possible from Dan's program as well. Follow us on Instagram for updates, and then visit our Learning Center for the data I spoke about at the start of the program. We have the latest antipsychotic drugging data, the latest staffing data, and then we have fact sheets on nursing home standards, assisted living guides, family empowerment resources, and resident abuse, neglect, and crime reporting center. Thanks all very much. And again, Dan, thank you very much. Wishing you all a nice and be careful, cool afternoon. Bye-bye now.
Thank you all.
Thanks so much, Dan. Nice to see you.